All right, uh, so I guess we'll get started. That's okay with everyone. Honestly, the second part of my presentation is very much has a lot of sort of overlap with the first part, so I don't want to. So I'll kind of skip over any areas where I might have already addressed. But essentially, so the first part was mostly focused on really looking at preventative health screening and some case examples of preventative health screening that can be optimized using a variety of different sort of techniques. Specifically using AI and technology automations, leveraging upskilling staff, and then also taking advantage of community resources that you can partner with, whether it's pharmacists or diagnostic facilities, things like that, and other specialists to create different pathways and advanced directives. So this part is essentially just kind of reiterating that, but also just highlighting that for things even outside of preventative care, essentially. So it's really just thinking about yourself not working in a silo, but really kind of building out your medical team as much as possible. So first would be just within your clinic. So again, really leveraging the technology and things that are available to you within your own clinic. Number two is again doing your best to upskill your own staff as much as possible. And then number three is to look outside of your clinic to see how to kind of extend your reach, right? So for example, Louise being the scope navigator, she's technically not an employee of your clinic. In fact, she's sort of a free resource for you to use. But she's nevertheless part of your medical team because whenever you have issues for a patient and she can be of service, she's happy to help you and she's just a message away. And there's other resources like that within the community as well. So again, really just the focus is the same, is really how can we make our lives easier, save time, and work smarter and not harder as a physician. And I think what I'd really want to do probably is really, again, just, really looking at thinking about how to automate things as much as possible and to, in terms of building systems. We talked about some examples in terms of appointment booking and reminders in the context of preventative screening, but of course, just making that in general a policy as much as possible. Although it can be tricky trying to find a fine line between how to kind of gatekeep appointments as well so that they're not being abused and that they're being used appropriately. So that does take a bit of finesse to figure out. Again, like normal results notifications is just even outside of preventative screening, it's such a huge time savings. As I mentioned, it was something we struggled with in our clinic, and we were able to find a vendor where all you do is you right click on on a result that's normal, and you just click contact patient with the normal template, and it's done. And it would actually call the patient, tell them their results were normal, and if they didn't answer the phone, which a lot of people don't do, it would automatically send them a text message, so that you know for sure that that's kind of done. Again, creating recall systems for different things that might need to be done at a later date. And then again, inbox triage and task routing. So again, looking at automating things for your staff, like faxes coming in, and so many other things. Even like for specialists, for example, there are now tools that can take all inbound referrals and automatically generate a chart for that patient. So it doesn't need to be done manually anymore. It's able to read everything through the fax, that pull the patient's health card information, name, contact information, everything, create a chart for them, and then put it on a pile that needs to be looked for your admin to create an appointment. But even those can be automated, right? So even those, they can send an appointment calendar to the patient automatically and say, look, you have your first consultation with such and such specialist, and you can choose your own time and things like that. So a lot of great ways to automate things as much as possible. Um, and then in terms of making sure you have the best value for the team that you have. So really just thinking about who are the staff that work with you right now, what more are they capable of doing in addition to what they're doing already, that can take that can free up your own time. And these are some examples again, like with what to do with sort of results, follow-up, screening calls, um, appointment coordination. Um, so that's been a huge help in our clinic, and also offering cross training as well, because you never know when someone might get sick or might have to go on leave. There's a lot of turnover that might happen. So also making sure that even if you have, let's say, like a nurse that's obviously overqualified, and mostly doing a lot of patient care, but let's say your front desk staff can't show up uh, for whatever reason, that they can fill in and easily handle with all the administrative stuff. And let's say your nurse doesn't show up, but maybe your front desk staff can still be trained on how to start the automated blood pressure cuff to take vital signs, help with urine dipsticks, maybe at least help get all the PAP stuff ready for you if you've trained them on what items you'll need, get the patient changed for you, and counsel them about what the procedure might be like, et cetera, et cetera. So these things might really help with decreasing your own burden and headaches. Um, so we kind of talked about that. Protocols. And then the last thing is really about taking advantage of the patient's medical home and really taking advantage of the community. And I think this is where Germ is really growing in terms of having more and more services, and that can help kind of be an extension of us. And so I'll share some of the things that I'm aware of, and there might be many others that you might know, and there might be a lot more down the pipeline. And again, Louise would be a great resource to help kind of keep all of us up to date as she finds out, or as the community finds out. So for example, as I mentioned, like, making use of clinical pharmacists that are near you, to help with things like deprescribing, doing medication reviews, chronic disease optimization. Even sometimes they might be able to help with certain parts of diabetes education, for example, starting insulin and how to take needles, things like that, how to do um, sliding scales, partnering with different diagnostic clinics, as I mentioned, to help with offloading some of the work for booking patients for different tests that they might need, and helping with follow-up and flagging results for you that are abnormal. So that's been a big help. As I mentioned, like, what family doctors do now is they might just send us, a list of all their patients, or even for their whole clinic-wide, that meet the criteria and that need testing done, and that's off their chest, for example. Some other similar examples would be like Best Care. I put their website here. You can take a look if you haven't heard of them already, but they'll have educators that will come and look through your list and try to look at patients with some of these chronic conditions, and make sure they're optimized, and do education for you, counseling for you, and it's all free. There's no cost. There's no cost associated with it to you. So great service for family doctors. There's Community Care Durham, so they provide a lot of local support services and resources for patients and caregivers. This is just an example of some of the services they offer just from their website. And a lot of this is self-referred as well, so it also saves you the work from having to refer. But you can just point patients in the right direction. So like adult day program, assisted living, supportive housing, transportation, personal support, caregiver relief, foot care clinics, Meals on Wheels, etc. There's also the Durham Region Community Paramedicine Program. So these are paramedics that are trained to help sort of with primary care for homebound patients, so they can kind of be your eyes and ears to see people in their homes when you're not able to get out and go and see them. And they can connect, they can call you and let you know how your patient's doing, if they're decompensating, and what other steps need to be done. Um, yeah, some additional programs. So Dr. Kennedy mentioned about Dr. Angaran and they're building integrated palliative care programs. But even aside from that, we have excellent we're lucky to have excellent palliative home-based and outpatient-based and inpatient-based palliative care programs all across Durham region. There's a new program geared towards helping with limb preservation within the Indigenous community in Durham region. And so these are just some small examples of other programs that you can lean on that can help extend your reach and make life easier. And as I mentioned, the idea is really to decrease our workload, but still be able to increase our capacity and leverage. So that's essentially pretty much everything I wanted to share today. I hope that this information was helpful, or at least might help sort of get sort of the gears going in our brains in terms of how to automate things. And to be honest with you, like there's so many other things even outside of clinical medicine where I'm starting to use the same kind of methodology in terms of time savings, to really help with, just life in general. Like, before, like growing up, it was always a given that we'd go to the grocery store to get groceries and things like that. And now one of my friends put us on this Walmart subscription where you just put everything on app and someone will actually grab it and deliver it to your house. And like it's helped so many times, whether it's a grocery list, whether it's like you just need Tylenol and Advil quickly for your child who might be sick at home and you just don't have the ability to get out and go and grab it and come back. And it's there, within an hour or so. So like also just kind of looking at different hacks in your in life in general, I found has been very helpful, because these things are available to us, and sometimes they might cost money or they might, but the returns are like much much bigger in terms of what you get back, in terms of peace of mind, time savings, things like that. So it's obviously a personal decision. All of us have to kind of decide on what where our priorities are and what we're willing to sort of give up for those conveniences. But I find that at least having those gears flowing and thinking that there is another way, and there are ways to make things more efficient, faster. Is helpful. Even like open evidence, I find is really helpful. There's a lot of like groups that I'm on, WhatsApp groups where physicians might have some question or challenge of how to manage their patient. And Up to Date used to be a great resource, but now open evidence. I'm not sure if all of you have used it or have made use of it, but it's a great clinical decision support maker that's free for all doctors, that you can either have on your phone, on your laptop. You just type in the prompt, like, I have a 35-year-old with this type of a rash and they're febrile, and can you please help me diagnose what it is? And it'll give you the full differential, what labs to order, all those things. And obviously you have to kind of vet it and make sure that it makes sense to you clinically, but usually it'll give you the methodology or the rationale behind it. And again, a huge time saver, and you can use it in the clinic with patients or outside. There's so many times where patients come in with something that I've never seen before, and I'll just type in all the symptoms in there, and it'll actually give me the diagnosis on the spot, and I'll be like surprised, how accurate it is. So that's pretty much the nutshell. I don't want to take up more of anyone's time today. Thank you for this opportunity to share some of these tips and tricks, and happy to take any questions. And beyond that, hope everyone has an amazing weekend, and hope we're able to save everyone's time moving forward and have more time to yourselves and to do other things that you love to do.
Great. Thanks so much, Suleiman. Another excellent presentation. I really appreciate your time and giving us these two perspectives and kind of lenses on how to save time, and be that within your processes and practices, or who you can have as your team to take on and extend your reach clinically. So open it up to any questions. I see some thank yous in the chat, so that's great. Any questions, Dr. Firmly? I'll ask one of you, if you don't mind, Suleiman. Just interested in how you see the role of Ontario Health at Home. Like, is this a team member that you use often, or you think that the support of the team could also help to extend your clinical reach. Looking at, they have OT, PT, social work, speech language. So that Ontario Health at Home team, is that something that you use in your practice, or is that something that I think we'll just be candid, sometimes they get a bad rap? Is that kind of how people are feeling about them, or are they somebody that you would consider as part of the team?
I think if I'm not mistaken, Shannon, just to clarify, I think Ontario Health at Home, is it essentially like has replaced the LIN, is that right? Like what we used to refer to as the LIN?
Yeah. They've had a million names, CCAC, home care, that home care bucket though.
Yeah, in fact, I actually had their website, or I think I was supposed to mention it in that same group with the some of the community supports. I'm not sure why I didn't make it to the slide actually, but yeah, I think definitely they would also be a good resource in terms of the home care, for patients who need certain home care, whether it's PSW. I used to use it a lot, especially in the context of palliative care when I used to do home visits and things like that. But yeah, definitely another great resource to kind of help extend your reach. And I think the other good thing about it is I think some aspect of it is also self-referral is available for patients to reach as well. So that really helps. But obviously it's good for you. It's good for us as a physician to also be able to advocate and maybe specifically mention like what things might be needed for that patient and to send it in. So yeah, definitely another great resource to add.
Thank you. That's great. Okay, just some more thank yous in the chat. So I think that will bring us to, oh, there's another one. Thank you. Perfect. Okay, another thank you. Lots of thank yous, Suleiman. Thank you. Just asking if everyone wouldn't mind to do our evaluation. As Louise said in her presentation, we'd love to hear from you, the good, the bad. We can only get better if we know what you're looking for. So I've put a link in the chat, and then on the screen I'm sharing the QR code if that works better for you. So thank you very much for taking a quick couple minutes to do that evaluation. And then just again, I did make mention of this, but we do have next month our education session is focused on mental health and really looking at what we've heard from the WhatsApp chat, what everybody kind of seems to have questions about. We've tried to pull together an expert panel of psychiatrists and other multidisciplinary providers from the team at Lakeridge Health and Ontario Shores to speak to some of the questions that have come out through the WhatsApp chat and really help with how do you navigate mental health in Durham Region? What are the resources? What's available to primary care? What supports are kind of available if you have a patient in crisis in your office, those types of things. So, and what are the gaps? That's another big one. Just looking at a lot of the discussion about adult ADHD and autism diagnoses. What are those supports and what's not available currently? Because I think there is certainly some gaps in the system right now when it comes to those types of things. So hope to see you all in May. Again, last Friday of every month, we're doing these education sessions. And so we'll keep your calendars clear and hope to see more and more people join us as we do this. So thank you so much again, Dr. Firmley. Lovely to have you. Thanks to Louise, who had to pop off, but great presentations today, and wishing you all a very wonderful weekend, and see you next month.